Accurate, simple progress notes are essential legal and professional part of any practice. Quite often, progress notes are plenty of information but are not well organized. For years, we have been taught to use the SOAP approach to write progress notes. SOAP stands for Subjective, Objective, Assessment, and Prognosis. Although that style is acceptable and can be useful, it may not provide the type of detail needed in today's dental practice. At the University of Texas Dental Branch, we teach our students to use FOTEN style of writing. FOTEN stand for Plan, Procedure, Health, Oral Hygiene, Treatment, Evaluation, and Next Treatment. Although this style is perfectly appropriate, some of us have doubts about its adequacy. As an alternative, I would like to offer another way of charting that I have used in the past. The first and most important information collected should be the patient's chief complaint, or CC. It is very important to write this verbatim without any change. The next important item is diagnosis, or DX. No visit should end without at least a tentative diagnosis. Understandably, it is not always possible to make a definite diagnosis without further tests, consultations, or radiographical evaluations. However, a broad differential diagnosis and/or full descriptions of existing conditions that may lead to a possible diagnosis must be written in these sections. Taking a medical history is a must for any prudent practitioner. In fact, in many jurisdictions, the law requires a complete medical examination, including vital signs. At the minimum, all visits should record the patient's blood pressure, heart rate, respirations, and temperature, or the chart should note why they were not recorded. Information about the patient's general health, previous laboratory tests, systemic disorders, and allergic responses should be noted here. Next is treatment sections, abbreviated as TX. This section can include pretty much everything that did not go elsewhere. The best way to start this section is to describe your findings, such as color, shape, consistency, size, and locations of the symptom, pain, lesion, or abnormality. With advanced technology, we can take clinical photos and videos that will enhance exam quality and help with patient educations. However, images alone are not a substitute for good written descriptions that addresses the color, dimension, depth of the field, and other valuable informations. In this section, you should also note what you did for the patient, which treatment plan options were discussed, the patient response to the presented treatment plan, and so on. Medication, abbreviated as RX, given or recommended, should be charted here. Many practice management software programs can record your prescription automatically. If your software does that for you, you may only need to write see above or see below. Next visit, or abbreviated NV, should be the last piece of information to record in this chart. No matter which system you use, accurate and clear writing should be the goal. Organized note will make it easier to read or audit your record. I hope these suggestions have been useful and that you can implement them into your record keeping regardless of which style you choose. Thank you for your attention and look forward to see you next time.